So my question, I'm family practitioner in Cowansville in social pediatrics in a small city, but a greater rural region in the mountains, actually. And out of personal interest, because it has been some 10 years that I've come to see, and I'd like one of the four individuals to answer my question, what's your vision, your perspective on what is pleasing to the eye? When we're a researcher, we're looking to do more with less money, and what we come up with is not always very pleasant to the eye. And we always think that, the underprivileged, they live in a lesser environment, less visually appearing, not so nice to look at, etc., less beautiful. And studies have proven this. So how about aesthetics? The impact on the health of people. Do you have anything to say about that? I don't know how you define aesthetics, but I'm thinking of the Montreal neighborhoods and what we're able to support thanks to our documents. There was a conference at McGill, Health Canada, researchers that were drawing the link between entertainment and mental health. So that's quantifiable now. We've got research publications. I find it extremely interesting. What I see in Montreal in terms of beautification is visual, the murals, the graffitis, the taggers, etc. So you've got groups that are embellishing the walls of their neighborhoods. So what we're pushing for with the City of Montreal and the sustainable development side of things is to push forward culture. So embellishment passes through culture, is done thanks to culture. Works of art. I've seen examples of this in cities. Barcelona attributes great value to art in the different neighborhoods. We say that Montreal is the city of design, but I think we could do way more. And I'm convinced that there is a link between that and the physical and mental well-being of all children within our population. Absolutely. Why this flagrant dearth of colors? I've often wondered about that. Why is there so much gray and again more gray? Juan. I can answer with respect to aesthetics. Yes, the beautification of a city is very important. I can tell you about the drama in urban development because aesthetics and order is very important. We're trying to favor order. We're trying to imagine a proper life environment to raise our children, to have a happy family. We're looking for order, regularity, and then you think of a small house, the picket fence, a little yard, similar to that of your neighbors, right? So everything is homogeneous. But that's how we visualize things. And this visualization is very strong. Sociologists have gone back to Quebec movies, and you can go way back to the origins of our Quebec culture. And this image is extremely strong, this homogeneity. But as I said beforehand, a compact environment is a rich environment. It's diversified. The aesthetics of that reality are completely different. It is hodgepodge. There are differences in the colors, diversity. Something that could be first judged as being ugly, but that offers, through its quote-unquote ugliness, opportunities for a sense of belonging, for a possibility of building an identity. And also in terms of a development process, when children grow, you can identify to a yard and the swing when you're 6 years old. But when you're 12, you want to move away from that, shy away from it, and think of something else. So this diversity holds true from an aesthetic point of view, but also from a practical point of view. And the risks we mentioned at the very beginning, the lack of control, uncertainty.
Well, I'm very happy to hear this question. I think it's essential. 6 years ago, I was fortunate enough to live in Berlin for a year, and I learned a great deal from the Germans and also Scandinavians about the way in which they actually organized their universe so that it's aesthetic and pleasant at the same time. And they've got this interaction between the two that was mentioned by Juan, and I'm going to come back to that in a minute. But one of the things that we have found in our research, and which we find also in the literature, is that because of this fear of taking risks, or for children taking risks in courtyards and parks, we've tried to ensure that the modules that are there are really boring. They're unidimensional. You can just do one thing with them. And the surfaces have been made so that kids don't hurt themselves if they fall. It's really boring. It's not beautiful. It's not interesting at all. So if you remove all of that, it would be far better and put up something that's far more interactive where you can actually build things. Look at the parks in Berlin. It's amazing. In the parks, there's always water and sand and modules that are made with natural materials such as wood. They can be used in many different ways. You can learn about science with these modules. You can climb up it in different ways. It's really amazing. I had a 5-year-old back then, and I was really blown away that his life was so different thanks to these parks. The children, of course, are dirty after the park visit. And sometimes it's hard to track them down because the parks are pretty big. They create these spaces intentionally where children can go off and hide. It's really not rocket science, is it? And I really think it's essential, this point that's been raised. And participate, it's true, it's not rocket science. It's true that we can do this. And it costs less, but there's always a but. The municipalities want to avoid litigation because sometimes also there are certain standards, and the landscape architects are very concerned about this situation. There's an enormous amount of pressure to remove any form of risk. I'd like to come back to this question of the use of research data that we've been discussing since this morning. When we carry out surveys amongst parents, one of the determining factors for their choices for their children is their fear of having a road accident. So how should we actually interpret that? As a planner, should we take the decision to say, right, we're going to try and reassure parents as much as possible by removing as many risks as possible? Well, then the bad news, in fact, is that we cannot have a zero-risk situation. There'll always be a risk. As an urban planner, it's better to create environments where children can gradually learn to manage risks. So we have to carry out urban planning in an environment where we can support parents as they teach their children to become autonomous, as they transfer autonomy from themselves to the children. And in fact, they've got this moral obligation, not really to protect the child, but rather our parental duty is to ensure that our child doesn't actually need our protection anymore. So this means that we need to have planning where children can be gradually exposed to different situations that become increasingly complex over time, so that one day they're able to find their way through these risky areas as we try, for example, today to get across the rails when we're running a bit late like this morning. Thank you. Sometimes I wonder about this point. Yes, we want our children to become more autonomous, but we're in a society where even as an adult we have less and less freedom. Even just when we cross, when it's a red light, you get ticketed, and that's when you're out walking. So there is this culture that exists where we've got less and less autonomy, even as adults. So how can we transmit this to our children? Do we still know what it actually means to act autonomously? We had a comment from Mr. Eastwood, I think. Would you like to intervene?
Thank you very much. My name's John Eastwood. I'm a paediatrician and public health physician from New Zealand, now working in Australia. I had the good fortune as a student to study in Uppsala, Sweden, with Ragnar Buffenstam, who was, I think, passed away maybe 3 years ago. Was a great loss to us all. He was the founder of World Child Injury Prevention, I think, with his colleague with the Red Cross, the world's first Child Injury Prevention Committee in 1954. I very much enjoyed this discussion, and I think much of what I wanted to say, Joanne just answered while I was losing my headphones. I think this is a very complex issue, requires a transdisciplinary approach. It actually does also require science and requires data and requires quite sophisticated research and very sound and sophisticated planning, because everything that you were saying, Joanne, it can be achieved, but not maybe ever to the 100%. I've observed a number of countries, we call them jurisdictions in Australia for some reason, that spaces can be created whereby we've got to approach it with developmental science as well as injury science as well as planning science. Spaces can be created that are safe for the 3-year-old, but are not. But we know that the 5-year-old is going to climb that fence, is going to climb that tree, and we have to do something more sophisticated. I've seen open play areas with a graduation so that with physical barriers, maybe like a hedgerow, whereby the parent can see the older child playing in a different space, but the younger child's playing in this space. The urban built environment creates other hazards, and I'm not a road traffic engineer, but I, in a younger time, advocated strongly for traffic control measures around speed, and this becomes very difficult for societies to accept 30 kilometre an hour speed zones. Gradually over time, a number of cities that I've lived in have actually achieved that by going to 60 kilometre, 50 kilometre, 40 kilometre, 10 kilometre. So you can have areas, as even out our window here, that could be speed pedestrian zones, so that our 10 and 12-year-olds, because we remember when we were 10 and 12-year-olds, we used to explore great spaces, old buildings, derelict ships, wharfs, trees, cliffs. If our parents only knew where we were, what we were doing, but they can never be made perfectly safe. As a paediatrician who studied injury prevention for about 30 years, I had a public health physician senior who was concerned that we were trying to bring the height of play equipment lower, and there was an obesity epidemic, and so we had these two problems about reducing activity and making play safer. I think we reached a compromise where I said broken bones were okay, but not broken heads. So I think it's about what injuries are we prepared as a society to accept? What injuries as a society are we not prepared to accept? And I think drowning is one we're not prepared to accept. And last time I was in Stockholm, I was pleased to see the safety life raft wheels all along the riverbank and little dinghies, so you could go and save people, I think. So anyway, that's just my reflections. I think science is important as well to all of this, and some maybe balance. Yeah.
Oui, tout à fait.
Thank you very much. I'm Catherine, I'm a nurse, and I want to talk about the clinician's point of view. What happens when this mother or this child has fallen and broken their arm?
Respond to that when the mother comes in and the parents come to the emergency room. Et ce que je vois beaucoup, c'est
Often people say you shouldn't have done that.
Alors, there's a self-blame and a fear of judgment. Et je pense aussi que
And at the same time, I think we can do things to help healthcare workers to actually understand that it is normal to have injuries, to be injured.
il y a d'autres choses aussi, c'est plus compliqué que ça, mais je pense
Some things are more complicated, but I think that we can do far more work with frontline care workers within the system. Well, perhaps I'm not going to express the most popular opinion around here in the cafe, but I do understand parents. I work in Hochelaga Maisonneuve, and I do understand that parents don't want the park to be dangerous or for children to learn in the park because they'll have to take many risks crossing streets before they get to the park. It's hard for me to express this, but I do understand that parents want the park to be hyper safe and antiseptic because in Hochelaga Maisonneuve there's risks everywhere already. I also carried out obstetrics and hospitalization in pediatrics, and there was I heard there was a small boy who was going to be coming in who'd fallen from his bike. And when he arrived, people said, he's blind. And the nurses said, wow, he's blind, and how come he's broken something? And the parents weren't thinking at all. But apparently he wasn't he was only partially blind. And it's great if he was given an opportunity to learn to ride a bike. It was great. So it's all in the perspective. You could think that the parents are responsible, or else you could think the parents have actually given him a great opportunity to actually push himself to the limit.